Bloody on call? No problem. Stay calm and transfuse on. Hi, I'm Dr. Hermelin. I'd love for you to join me to discuss the major blood banking topics you are going to encounter when you're on call. This video is specifically focusing on the request for red cell exchange in the context of sickle cell disease. Let's get started. Before we jump right in, please know that this video is intended to help learners approach blood bank or transfusion medicine topics. This is not medical advice. Make sure that you follow your own institution's guidelines and policy, and always refer to the experts in your own institution for further guidance. Now let's continue with the case. The most common way you will be notified about a request for red cell exchange is when your hematology-oncology colleagues page you for the request. And that's because sickle cell disease is a hematologic disorder, and red cell exchange is common therapeutic management, which can drive down hemoglobin S, which causes symptoms, while preventing iron overload. So let's imagine one of our hematology-oncology fellows calls us about a 33-year-old man with a history of sickle cell disease, admitted yesterday with diffuse pain. But now he's got chest pain and requires increased oxygen support. How soon can you start a red cell exchange? At this point, make sure you get the patient's full name, date of birth, and other patient identifiers, and get a brief patient summary from the fellow. Make sure you get their contact number and let him or her know that you'll call back shortly after you've investigated the patient's medical record. Step 1 is collecting and summarizing the relevant clinical history and laboratory data. So after you find out the patient's name, age, and gender, you're going to want to find out what type of hemoglobinopathy does this patient have. So for instance, was this patient diagnosed with hemoglobin SS disease, or perhaps it's hemoglobin S beta thalassemia? What would be really cool is if you have access to the patient's hemoglobin electrophoresis. And this is where the integration of all forms of clinical pathology come into play. Next, you're going to want to investigate the patient's current symptoms. Does the patient have generalized pain? Is that pain well controlled, or is it focused to the chest? Is this patient on supplemental oxygen? And this gets me to my next point. Does the patient have any radiographic findings that can help clinch the diagnosis of acute chest syndrome? Then I want you to investigate, does this patient have a current type and screen? And does this patient have any history of other red blood cell antibodies? Also, check at that time the CBC, particularly the hemoglobin and the hematocrit. Start to investigate the patient's recent transfusion history and find out if this patient receives chronic red cell exchange procedures, and when was the last time that patient did have one. Then finally, you're going to check to see if this patient has venous access, meaning does this patient have a central line, or will this patient be getting one? Or does this patient have specialized ports that can be accessed for apheresis procedures? Step 2 is deciding the ASFA indication for red blood cell exchange. You'll notice in the ASFA Guidelines there are 2 sections for sickle cell disease. The first one is sickle cell disease in the acute setting and sickle cell disease in the non-acute setting. And notice that in both sections there are different indications in corresponding different categories. Step number 3, it's time to discuss and summarize with your transfusion medicine attending. Once you have collated and summarized all that information and decided which ASFA category indication this patient fits into, it's a good time to call your attending and discuss the case. This is a great opportunity to start building and exercising your clinical intuition muscle, meaning you're going to synthesize and take all of those islands of information and help come up with a diagnosis and standard way of caring for a patient. Now that you've had the discussion with your attending and you both agree to move forward with the request, it's time to calculate the patient's red cell replacement volume. I love using the Terumo BCT app. It's one of my favorite blood education apps on my phone, and I use it to calculate the patient's red cell volume. You'll need to know the patient's weight, height, start and end hematocrit, start and end hemoglobin S. And you put that information into the app and it helps you to come up with the patient's red cell replacement volume. Once you've calculated your red blood cell replacement volume, it's time to order the units corresponding to that volume. You also want to make sure that you order it according to a sickle cell disease protocol, which means that the units will be hemoglobin S negative, as well as big C, big E, and big K antigen negative. And if the patient has additional alloantibodies, you supply antigen negative units in that case. Then you're going to want to place the orders for red cell exchange, and according to the institution you are affiliated with, you'll have your own manner of doing that through the electronic medical record system. Once I've placed the order, I then like to consent the patient for the procedure and for the blood products. You should follow your institution's guidelines of providing consent for your patient. After I collect consent from the patient is the time I then like to write and post my consult note. And that's because I like to document in my consult note that I receive consent from the patient. I also document the patient's clinical history, pertinent lab findings, and the assessment and plan. Step number 8 is then communicating with the blood bank and the apheresis nurse. So much of your job, and if you do it well, is coordinating and communicating with all clinical colleagues and members of the team involved in the patient's care. So at this point, you can call the blood bank and just say, I wanted to give you a heads up that I placed orders on a patient for red cell exchange, review the orders and the special needs for these blood products. I also will be in touch with the apheresis nurse and let the nurse know about the status of the blood products and the status of the patient's central line. I also let the apheresis nurse at that time that the patient has been consented and some of the details about the patient, such as the room number. You will be surprised that those little details go a long way. All right, everything's ready to go. The orders are in, your consult note is in, the line is in, and the blood products are ready. So now it's time to start the procedure. Again, I think it's really important to be visible and to support not only the patient, but the apheresis nurse. So it's a nice courtesy to pick up the blood and bring it to the floor as the apheresis nurse primes the machine. I also encourage our own residents to be at the patient bedside for the first 30 minutes of the procedure and to be available at all times that the procedure is occurring. Once the procedure is complete, make sure that the apheresis nurse collects a post-CBC and a post-hemoglobin S, either electrophoresis or quant. That way, you can make sure that you achieve your red cell exchange goals. Your job as an on-call resident is to learn to be an independent pathologist. And you're gonna try to take ownership of your case and be able to manage it from start to finish. But there will be times that you may feel like you have gaps in your knowledge. So you wanna make sure that you ask focused questions to your attending so you can build that knowledge quickly. Also, never be afraid to ask. It's better to ask than assume. I know what it's like to first take call. It can be a little intimidating, but guess what? You've got this, and you're gonna do great. For additional resources, I highly recommend that you read through the clinical guidelines published by American Society of Hematology 2020 for sickle cell disease transfusion support. Also, listen to the Blood Bank Guy podcast, Antibodies and Sickle Cell with Dr. Gehrie. It is fantastic and you will learn a lot. Well guys, I hope that you found this video to be helpful in thinking about how you would approach in a systematic way a request for red cell exchange. I will be posting a tutorial. You'll find the link below on these topics, or you could check it out at Hermelin MD. Remember to be positive and to transfuse knowledge. I'll see you next time. Bye.